Welcome to the Tallahassee Trust for Historic Preservation's presentation on the history of Sunland training centers and hospitals that were created as long-term care homes in Florida, and specifically about the Sunland Hospital built in Tallahassee. As a content warning before we begin, many of the articles, and even the official government documents that are referred to, used antiquated language regarding the patients at Sunland. They used many terms and descriptions that we would generally find offensive today. We've done our best to ensure that we discuss the patients with more modern, forward-thinking language. But there may be times when discussing the names of organizations, or when using direct quotes, that we will use some of these terms. Please be aware if you have difficulties engaging with this content. Thank you. We're going to start by hearing about how the creation of Sunland training centers and hospitals came about, as there was an entire line of centers created by legislative act. Next, we'll discuss the use of Tallahassee Sunland. It originated as a tuberculosis hospital in the 1950s and was later converted to Sunland in the 1960s. It was eventually closed in the 1980s after numerous lawsuits against the Sunland institutions and their treatment of their patients. That's where the local folklore begins. We'll talk about why folktales about hauntings in abandoned hospitals are prevalent. This can be linked to how they reflect the fears that society has about death and the unknown. These stories serve as a means of processing the trauma associated with medical failure, and they create a narrative that transforms these eerie, isolated spaces into pieces of collective cultural memory. Even though Sunland was demolished in the early 2000s, people in Tallahassee are still fascinated by it and its somewhat gruesome history. Long before Sunland, in 1919, the Florida legislature passed a bill that provided for the creation of a state institution. Land was donated in Alachua County, and the Florida Farm Colony was born. Facilities like this were built all over the South under the guise of new social welfare systems. However, by the 1950s, medical knowledge was changing about the causes of certain developmental challenges, and that more nuance was needed in the diagnosis and care of these individuals. There was also growing public concern that government institutions weren't doing enough for patients. To this end, in 1957, the Florida legislature created the Division of Child Training Schools. Its first director was put in charge of creating the Sunland training centers, beginning with the transition of the Gainesville Farm Colony, as its function had been under debate for a long time within the broader context of the state's social welfare policy. The first Sunland Center filled quickly, with 1,400 patients by 1959 and an 18-month-long waiting list. The demand for more centers grew. Between 1957 and 1968, the state opened further facilities in featuring Myers, Orlando, Marianna, Miami, Tallahassee, and Arcadia. The hospital that opened in Orlando and the one in Tallahassee were the largest and were reserved for more severe cases, where many of the residents were non-ambulatory. Sunland's stated goal was to change the priorities in the care of the institutionalized, to provide education and training rather than mere custodial care. They imagined a non-institutional institution based on the feeling of family care. By the time the final location in Arcadia opened, it was becoming clear that they were falling far short of this goal. In Tallahassee, the W.T. Edwards Tuberculosis Hospital was built in 1952. It was a state-of-the-art facility at the time. The hospital was located on Blairstone and Phillips Roads, which was, then, far beyond the city limits. It was considered to be in the country, where patients could be in the fresh air. What happened to the hospital in just 30 years for it to be left abandoned? First, the hospital was only used for tuberculosis patients until 1966. Once a vaccine was created, the number of cases in the U.S. dropped dramatically. The State Tuberculosis Board even disbanded in 1969. Since there was no further cause to keep the facility open due to the lack of patients, it closed while the state decided what to do with it. The former W.T. Edwards Tuberculosis Hospital reopened as Sunland Hospital Tallahassee in 1967. And within 2 years it was being criticized for being overcrowded, underfunded, and it was said that it was, quote, hardly suitable for the home-like atmosphere the other cottage-oriented institutions tried to provide. What went wrong? Across the various Sunland hospitals, things started going wrong quickly. Throughout the 1960s, while the facilities were still new and opening, many of their problems were administrative. There was no consistency in how each facility kept and updated their patient files, so when they sent them to the state division in charge of the program, it made it hard for them to keep accurate records of the entire patient population. One reason for the long waiting lists was that the facilities were also accepting patients who should not have met their criteria, either being better off in smaller, more specialized care homes, or even just at home with their parents, as most patients were minors. By the early 1970s, a number of legal cases were brought against the facilities regarding inappropriate treatment, including reports of abuse and punishment by staff who had insufficient qualifications to be working with patients with more severe needs. A 1974 report said that the Sunlands were overcrowded by 40% to 60%. It also noted a high level of internal tension, low morale, and little incentive to work in the environment. As time went on, the issue of there being too many patients wasn't resolved. Even though most patients came in as minors, many of them started to age into adulthood without being released. And even though the program had been designed to train individuals with cognitive issues in home-like environments, the Sunlands ended up being institutions even worse than those they were meant to replace. Closure of the Sunland Tallahassee. In 1979, a federal class action lawsuit was brought against the state and Governor Bob Graham over patient treatment at the Orlando Sunland facility. The state lost, and as a result, there was a judicial order to close it by July 1, 1984. Once the Orlando facility was ordered closed, the Florida legislature ordered Sunland Tallahassee to be closed as well. It took 4 more years for the facility to find new placement for all of its patients, not closing its doors until 1983. Through the 1970s and 80s, there was a wave of state and federal action that centered on protecting the rights of citizens who required specialized care. There was the Developmentally Disabled Assistance and Bill of Rights Act in 1975, Civil Rights of Institutionalized Persons Act of 1980, and in 1982, the Florida Bar Association established and funded a nonprofit called the Florida Center for Disability Law. During this time, many psychiatric hospitals closed as the result of deinstitutionalization, which was a movement that saw the gradual transition away from long-term institutional health care. The hospital's closure marked the end of the building's use after its first life as a tuberculosis hospital and its second as an institution. However, once the hospital was closed and abandoned, it began its third life as an urban legend. In this section, we'll discuss what happened to Sunland Tallahassee after its closure. Why do we create urban legends around abandoned places, especially hospitals? The confinement of patients for the reason of purported mental instability has a long history, going back to the Middle Ages. From its inception through the 1900s, the rise of the asylum centered on the commodification of mental health care. One report stated, "The asylum was not instituted for the practice of psychiatry. Psychiatry, rather, was the practice developed to manage its inmates." This type of statement leads one to thoughts of experimental and inhuman procedures, many stories of which exist surrounding Sunland hospitals. One website purports to have seen patient files that detail that type of gross neglect, but they offer no proof. There is also a claim that over 100 patients died throughout the 1970s, and that most of the children were buried in the woods. This certainly cannot be substantiated. There are reports to this day that the Century Capital City Apartments built where the hospital once stood has had frequent supernatural activity on the premises. This illustrates how stories steeped in legend continue to shape perceptions long after physical edifices have disappeared. From its closure until its eventual demolition, visiting Sunland became a rite of passage for many Tallahassee teens. Stories of ghostly apparitions and unsettling echoes of past residents attracted urban explorers looking to uncover paranormal mysteries, creating a shared cultural folklore out of the traumas that occurred there, and elevating them as part of a communal quest for meaning. This juxtaposition of historical reality and myth shows that we feel a broad cultural intrigue with forgotten places, where those boundaries between history and folklore blur. Thrill-seekers looked for spectral children wandering the crumbling hallways, telling each other stories of electric shock treatments and lobotomies. But it's hard to tell where the line is between fact and fiction. We don't have access to the kinds of patient records or first-hand narratives that would substantiate many of the claims made about the facility. The stories about Sunland and other derelict psychiatric institutions feature brutal medical treatments, inhumane living conditions, abusive caretakers, and dangerous patients. These narratives construct and maintain social stigmas and stereotypes about these facilities and their patients. Mental illness is often stigmatized in media representations, featuring characters in institutions like in One Flew Over the Cuckoo's Nest, or Sylvia Plath's semi-autobiographical novel, The Bell Jar. These stories brought awareness to the public of the potential horrors of institutional treatment in the latter half of the 20th century. But the closure of Florida's Sunland facilities by court and legislative orders seeded a fertile ground for urban legends. One expert on folklore explains that legends cannot be isolated as simple and coherent stories. Instead, they are products of conflicting opinions, arising from a complex dialogue involving believers, skeptics, and others in between. The most essential point is that legends do not allow us to ascertain the truth. Rather, they allow us to entertain the possibility of truth and are an important means of exploring the nature of reality. Accordingly, legend study offers a unique opportunity for understanding processes by which facts become narratives, and narratives become facts. As public consciousness expanded through civil rights advocacy and increased awareness of patients' rights, there was a significant reevaluation of institutional models. The Sunland hospitals and training centers were part of an institutional system that was criticized almost from its inception as providing places to live that ranged from merely unfit to condemningly horrendous. The initial closure of facilities, like the Tallahassee Sunland Hospital in 1983, illustrates a shift from containment to a more humane, community-based care paradigm. From its inception, which reflected mid-20th century methodologies, to its eventual closure, Sunland serves as a testament to evolving societal attitudes and policy reforms. Its demolition in 2006 was part of an urban development initiative, but also as an attempt to rid the land of its salacious history. In the mid-20th century, these institutions were presented under a set of modern ideals. The Sunlands were originally intended to be care facilities that were a symbol of humanitarianism, civic generosity, community pride, scientific progress, and economic vitality. However, despite well-meaning developments, the institutional system continued to be fraught with notoriety, and asylums like Sunland never got past being compared to their madhouse predecessors. There are more narratives than facts surrounding both the days that Sunland was in business and, more importantly, the days after it closed. Both the psychiatric healthcare system and the mental patient have been stigmatized and villainized in folklore, and we see examples of this in local tales about Sunland Hospital. It's important to remember that in the way we talk about an illness, in this case those who need specialized mental care, we can affect the ways that communities can perceive and interact with people who have those conditions. And we must ensure that, while it can be fun to share asylum legends, that we're not needlessly adding to Sunland's local infamy. Thank you for joining us on this journey through the complex history of Tallahassee's Sunland Hospital. From its origins as a tuberculosis facility to its repurposing as a state institution and eventual demolition, Sunland's story reflects both evolving social policies and enduring community memory. We hope this presentation offered meaningful insight into the real events that shaped Sunland, and perhaps a deeper understanding of how urban legends emerge from places marked by trauma and transition. If you have memories, questions, or stories related to Sunland, we encourage you to reach out and help preserve this important chapter in Tallahassee's history.